Welcome to the webinar, Deciding What to Implement to Achieve Successful Change. Go ahead with some introductions.
Will Hornsby is the Vice President for Child Welfare Practice at the Center for the Support of Families. Joan Nelson Phillips is a Senior Associate at the Center for the Support of Families. And Juliana Ormsby is the Region 10 Liaison for the Center for States.
With more than 25 years of public and private sector child welfare experience, Will Hornsby's work has been focused on implementation science principles, systematic problem-solving approaches, and assisting state and local agencies in monitoring their child welfare programs. With more than 30 years of experience in working with state child welfare systems, Joan Nelson Phillips is a CQI and practice improvement expert consultant. With experience working with states, tribes, and territories in Region 10, Juliana Ormsby's work focuses on implementation design and change management support, project management and technical assistance, providing strategic consultation, and enhancing collaboration between child welfare systems. I will now turn it over to our facilitator for the day, Nicole Barnes. Thank you.
Thanks, Chris. Spend just a minute going over our objectives and our agenda for today, and then we'll get right into it. So our agenda, we've got a lot to cover today. We are briefly going to review the objectives of today's presentation, and we're going to do a brief overview of the change and implementation process. We're going to kind of differentiate between well-defined, evidence-based practice and evidence-supported interventions. And then we'll talk a little bit about preparing to select an intervention, and then how to decide whether to replicate, adapt, or design a new one. We'll talk a little bit about how to define our interventions, and then how you set up a proposal and operationalize those.
The last agenda item listed is to discuss common barriers to intervention selection and how to overcome them.
And we're also interspersed throughout that going to hear from our expert presenters as well. So moving on to our objectives, we are going to identify the essential tasks in selecting an intervention for a change initiative and some strategies to research and assess interventions to address the problems and needs of an agency. We'll identify some barriers to effectively selecting interventions and also discuss some strategies to overcome them. And then, as Chris mentioned, we will have an opportunity for breakouts at the end, so you can connect with your peers around those strategies to increase our capacity to research and select interventions for change. All right, so we'll jump right in. So on the screen, the next slide is essentially the change and implementation process. It's a visual that the center has developed.
The intervention selection for change and implementation diagram shows a ring of concentric circles. The green outer circle is labeled readiness. The blue inner circle has 6 lines extending from the outer edge to 6 different phase labels. The phases, clockwise from the right, are problem exploration, theory of change, intervention selection and design/adaptation, implementation planning and capacity building, intervention testing, piloting, and staging, and monitoring, evaluating, and applying findings. The next inner circle is orange and is labeled teaming, and the innermost white circle is labeled effective implementation.
Talk a little bit about the series as a whole. We have currently to this point have produced the overview brief. We have a brief on problem exploration, theory of change, teaming, and readiness. And as of this last week, we also have today's topic, the intervention selection, design, and adaptation brief. Today, we're going to be specifically talking about how to select interventions for change initiative. As you can see in the graphic, selecting that intervention should come after a thorough problem exploration process where a root cause is identified, and then a theory of change developed that really defines the pathway from that root cause to a long-term objective. This really ensures that agencies are able to identify and select an intervention that's going to meet your need. And as with all steps in the process, having a diverse team and really understanding where your organization sits in its readiness for change and also for a specific intervention are integral to a successful change effort. So we'll talk a little bit about the brief. The brief outlines 7 steps, or what we call essential functions, in the process of intervention selection, design, and adaptation.
The 7 steps to intervention selection, design, and adaptation are: 1. Research possible intervention options. 2. Assess evidence, fit, and feasibility. 3. Determine if it's well-defined, usable/transferable. 4. Decide to replicate, adapt, or design. 5. Define the intervention. 6. Develop the proposal. And 7. Further operationalize the intervention.
Today we're really going to focus on the process of researching and selecting an intervention and the factors that will influence a decision of whether to replicate, adapt, or design a completely new one. We'll also have some further discussions down the road on the process of adaptation or designing a new intervention in some smaller group events, because we really want to allow for some greater opportunity to discuss those in smaller groups and sort of some of the strategies that go along with that. And then throughout today, as I mentioned, we'll hear from our consultants and experts who are doing this work in the field on their challenges and successes in selecting interventions, and then what types of situations might lead an agency to make a decision to adapt or design a new one. So we're going to do a quick polling question. We'd like to hear about your experience with selecting interventions for change efforts. So you can choose whether or not you have used a structured process like this before to research and select interventions. And then also there's a short answer piece there, the second question. If so, what challenges have you encountered in selecting interventions? And so as we can see, we're broadcasting those results. Feel free to just type in a short answer in the second piece when you get to it. Those answers are anonymous. So it looks like for the most part so far, a little close to about 60 to 70%, many of you have used a structured process like this before. So some of the answers on the challenges are difficult to streamline, yes, and getting buy-in from all of our stakeholders, yes, absolutely. Whether they're evidence-based, yes. Then the ability to scale up on a larger scale, so starting at pilot and how do we make it larger? Having the capacity to scale up, yes. All of those things, definitely some common challenges that we see in talking to jurisdictions, and some that we're going to try to address today. Others that may be addressed in some of our later topics in this series. Struggles to stay within scope and resource limitations, yes, absolutely. Turnover, great. Well, thank you all for participating in the poll. I think that we can go ahead and move forward into our slide deck. So I want to take just a moment to kind of reflect collectively on selecting an intervention. So we know that when selecting interventions as part of the strategic planning process, or even any improvement planning, it's really important to keep those timeframes in mind. When jurisdictions are under time restraints, it's certainly easy for us to make a choice to just select an off-the-shelf intervention, particularly if we can see that there's enough research to show that it impacts the problem and the root cause that we're trying to address. There are some important things, though, to keep in mind when we're looking at off-the-shelf interventions. As many of you may have experienced or know, that interventions that may be successful in one jurisdiction or system are not always going to be successful or transferable in another system. And almost all interventions, because of that, require some sort of adaptation. And unfortunately, adaptation can actually impact the fidelity, the way that we measure the intervention, and potentially even its effectiveness at impacting the targeted outcomes or the target population we're trying to address. So with this in mind, really thinking about what unique attributes may have contributed to the success of an intervention in another jurisdiction, what access to resources or existing infrastructure may have helped their implementation, what knowledge and skills did their staff already possess to increase the chances of successful integration into practice, what culture and climate support or partnership really helped to ensure that the intervention was effectively planned and implemented. These will really all be important considerations that your team will want to think about when selecting an intervention that best meets your agency needs and that really fits with your agency's system. So, well, what is a well-defined intervention? So for an intervention to be usable or otherwise transferable from one organization to another, as we said, sometimes that can be challenging. And for it to be successfully implemented, it really has to be well-defined. And what that means is that there's enough information and enough guidance for agencies to understand it and for individuals to understand it, implement it, and be able to observe it. So the 4 criteria that are defined by the research include a clear description, so a description of the intervention, including its underlying philosophy and its values and principles, and the intended population that it's intended to impact. Core components or essential functions that define the program and really outline those key building blocks of the intervention. Operational definitions of the core components are the more specific actions or behaviors that are going to be required for our staff to carry out the intervention. And then practice performance assessment tools. This will help us to enable the monitoring of the intervention. So together, these elements contribute to really making an intervention what we call operationalized. So as we discussed, there are the terms evidence-based practice and evidence-supported intervention that are used multiply in a number of different systems, and really their definitions can vary quite widely among different registries and directories. So we wanted to define a little bit for you how we are using these terms in this series of materials that the Center is producing. So in this series of briefs, when we talk about an evidence-supported intervention or an ESI, we're really talking about a well-defined policy, program, and service that has shown potential through some rigorous evaluation that will improve outcomes for children and families. And we know that these ESIs really kind of fall along a continuum of evidence and effectiveness. Some may have a lot, some may not have quite so much, depending on the evidence available. And when we know that we have the evidence that matches what we're trying to achieve and we can closely replicate it with similar populations, these evidence-supported interventions really, we expect them to produce a similar outcome. Well-supported intervention will be highly rated with both its effectiveness as well as the strength of the evidence that's available. And it will consider the experiences and the values of both the families and children that it will be delivered to and the workforce who will be delivering the intervention. We use the term evidence-based practice in the series really to refer to working with a child or family in a manner that takes into account the best available research evidence, practice expertise, as well as the values and culture of family and community members. So kind of to put it in a nutshell, when a previously tested supported intervention is successfully implemented as intended and found to be consistent with child welfare practice and our target population's values, then it really becomes part of child welfare evidence-based practice. So to select the best possible intervention for the identified problems, teams should really start reflecting on all of the pre-work that they should have done to this point, including that root cause analysis, so the causes of the problem or need, their theory of change that will outline that pathway to their long-term outcome, and the target population that they're trying to impact. And they can look at a variety of possible solutions from a variety of different sources, including some interventions that may have been implemented at other agencies or partner organizations. So we should look for those, essentially those evidence-supported interventions. Look for common elements in a number of different evidence-supported interventions. And we'll talk a little bit about common elements a little bit later. Look for well-defined interventions. We've talked about those criteria of what well-defined interventions are. And also look for promising practices. Collecting information from directories and clearinghouses. There are resources on the capacity building centers and the information gateway available. There are tons of studies, reports, and articles about different practices, online sources, as well as program developers and experts who have produced the interventions and our peers who maybe have tried to implement them in the past. So when we're looking for ESIs, teams may want to seek some information on those common elements that we were talking about. Those common elements are essentially the building blocks of interventions that help us address the identified problem. Common elements are shared strategies, they are techniques and activities that really are similar across a number of different interventions, and in particular they really can support teams who may have decided to adapt or design a new one. Common elements can be useful to identify best practices and to adapt interventions to a specific target population. So some examples of common elements in child welfare service areas include things like for a parent training program, it might be timeouts or positive reinforcement or some sort of psychoeducation. For family engagement and mental health services, it might be education about the services that are provided, goal setting, and appointment reminders. Or for in-home services, it might be more like family-centered case planning or comprehensive assessments of family strengths and needs, quality worker-family relationships, and also the availability of concrete services. Teams researching interventions should also look at literature reviews, and as I mentioned, they should be consulting other peers and program developers and experts. So when they look at these promising practices and interventions, they may be well defined for their needs, but kind of sometimes lack that rigorous evaluation data that we may be looking for. Promising practices, though, offer the opportunity to kind of assess the intervention from what we know to be practice knowledge and good theory. For example, while there may be a limited supply of ESIs for children in long-term foster care, when agencies are designing interventions to promote permanency, they can draw from a really strong body of literature that points to the importance of preserving relationships and addressing trauma. And then teams can really learn a lot about those possible interventions by talking with developers and experts, as well as peers, agency leaders and managers that have experience in implementing an intervention or even a component of that intervention. So those experiences and lessons can really provide a lot of insight to the agency around the benefits and challenges of a particular intervention, the appropriateness for different populations, how difficult it was to replicate, and any considerations that the team may want to look into. They can look at recommended implementation supports and the costs that it took to actually implement an intervention, as well as several other considerations. I want to introduce our panelists today, Will, Joan, and Juliana, and we're going to have them do a little bit of a panel conversation. So I'm going to start us off, and I'm going to kick it over to Will, but I'd like to ask the first question. Will, if you could tell us a little bit about what some of the challenges are that you have seen in researching evidence-supported interventions.
Thanks a lot, Nicole. I think a challenge that probably everybody on this line is very familiar with is just the challenge of time pressures and competing timelines that child welfare professionals find themselves in. And so in terms of thinking about intervention selection and thinking about the pressures from political leadership, the pressures and timelines that we find ourselves around navigating federal processes such as the Child and Family Service Review, dealing with external monitoring efforts such as consent decrees. All of these may be instances that are putting pressure and raising the stakes around trying to quickly find a solution to put in place, and it may run counter to having a comprehensive, thoughtful review and research process to try to identify evidence-supported intervention. And then compounding that is a challenge that Nicole already alluded to, and here again, thinking about the field of child welfare and the fact that we're still at a place to where there's not always interventions that are documented, that have evidence that are proven effective for similar situations or populations. So, finding that evidence-supported intervention, that may be very difficult. And depending on what we're looking for, there could be a very limited supply of what's available for consideration. And then another issue that Nicole touched on, but it cuts to the heart of this. So we're talking about the challenges around kind of the environment that we find ourselves of having to do these types of searches, the challenges about are we going to be able to find interventions to consider, and then just the challenge around the number of interventions that are out there that are well defined, that that it can be very clear for us and our colleagues around what the intervention actually is, to look at replicating or adapting, and there being oftentimes an absence of core components or common set of observable behaviors that when it gets down to the point of trying to implement something with fidelity, that there's a real challenge of being able to move forward. So with that, I want to hand things over to Juliana. And Juliana, if you could maybe recommend some intervention research strategies to try to move us beyond some of these challenges that we know that we're going to be addressing in looking for intervention.
Great. Thank you so much. I think I'm unmuted at this time. Thanks so much, Will. I wanted to share a few examples of working with states and tribes, and then maybe a couple of tips as well as you're thinking about intervention selection. So one state I worked with as liaison at the center, we helped them develop a strategy selection template to really help them guide a discussion on intervention or strategy selection after the project team had gone through a rigorous root cause analysis process. The team was walked through this template and the questions, and then we walked them through an example step by step to illustrate use of the template. And I wanted to share some of the questions on that template. This is something that you could easily replicate yourselves as well. But some of the key questions were really around, what have you tried before to address this issue? What new ideas do you have? So this is a real great opportunity for brainstorming, right? We're not yet at fit and feasibility, so it's the opportunity to kind of think big about what may work to address this issue. What research is out there, or evidence is out there that would support that this would be a viable intervention, right? So what exists, whether it's the clearinghouse, other data, what peers have done and had success with. How do you think through the capacity changes, both technical and adaptive, that need to be addressed? What questions do you need to answer before you move to implementation? And one other question you might want to think about is, how will you know that this is successful? So begin to be thinking about that. In another state, we did a crosswalk of multiple interventions. We conducted a lit review of existing information, what others had done on this intervention, and then we shared that as a matrix with the project to really kind of compare and contrast interventions. And this document was then used to guide a conversation with the project team in the jurisdiction around which elements of the intervention they liked or maybe didn't like. And that was then used to select the best fitting intervention, and this team is still working and will ultimately use that to adapt this intervention to really be tailored to the needs of the jurisdiction. In working with the tribe, we had special considerations around what would typically be considered evidence-based, and so it was really important to utilize a method that was appropriate for the tribal community, and so we worked with them to really explore what would be most appropriate as an intervention to address the issue that the community had lifted up. And so ultimately, members of tribal council and tribal social services and key stakeholders came together and had a great discussion on those interventions, and then utilized the colored dots method to kind of go around. We charted everything on the wall, and they were able to go around and sort of vote on which was most appropriate and deemed most feasible given the community resources and needs. And just a couple of quick notes before we move into the next question. Thinking about some strategies that may yield more relevant and applicable information than others. Just a note, and probably found this in your own intervention selection processes, just really important to, I think the strategies that include a diverse array of stakeholders are really typically what are going to yield the best response. I think this really gets to the buy-in question that folks had that came up quite a bit in the beginning of this conversation. And so being able to include those folks who are going to have a stake in this somehow and be impacted or affected by this, I think is a really good approach. Many of you are going to be working on CFSPs. Some of you are still working on PIP development, and many of you are thinking ahead to family first intervention selection. So we'd encourage you to take the tools and conversation here and think about how you might employ a structured intervention selection process or enhance a good working process that you already have. So, but that's it for me, Nicole.
Great. Thanks, Juliana. That was awesome, and thanks, Will. Great. We appreciate you guys' expertise in this, for sure. So great conversation. Let's move on to the next slide. We're going to, in this section, talk a little bit about how we can define and assess fit and feasibility, right? So does it match and can we do it? So if for each intervention that's a possibility, the team really needs to assess comprehensively the evidence that supports the intervention and whether or not that's a fit with the agency system and feasible within the system. So the fit really is that match between the components of the intervention and the organization that wants to implement it. If an intervention's been successful in one agency, again, we talked about it may not always align with another agency's priorities or their structures. It may not align with their contracting arrangement or their worker norms. And it may not be appropriate for the community's demographics or the target population's values, just like Juliana was talking about. The feasibility piece is whether we can do it. Or whether we could actually build the capacity to do it, to not only implement it, but also to sustain the intervention. Feasibility may require that we look at various aspects of our organizational capacity, including the financial capacity or staff resources available to plan and implement the intervention. Do we have the infrastructure to support service delivery? Do we have the needed knowledge and skills or the agency culture and system partnerships to actually sustain this intervention? So next slide, please. There we go. The teams should really think about examining the evidence of effectiveness for each of the intervention options that they're considering and look at how each of those will address the target population's identified needs. So some strategies might include reviewing the criteria on a clearinghouse that we talked about if it's available, reviewing studies or reports and related materials, looking for replication success with similar results, considering the evidence that's there to support implementation with your specific target population, and if not, is it possible to make some adaptations that would make it a better fit? And if needed, really looking at that practice evidence, talking with peers, developing a research-based theory that why we think it might work, and consult with other experts, consult with folks who have developed these interventions, consult with our peers who maybe have tried to implement them or parts of them in other jurisdictions to really fully explore each option. So assessing fit within agency context. So determining how our outcomes might vary by population or setting or other factors is really hard to measure. And teams often need to rely on the best information available at that time and their best judgment to assess fit within their context. And discussing those interventions with the program experts and local stakeholders, like Juliana was talking about, can really play a vital role in these considerations. That cultural relevance piece is an important piece of assessing the contextual fit. We really want the intervention to match the values and the preferences of the people who will be implementing it and supporting it. So, for example, our caseworkers, as well as those who will receive and benefit from it, so our target population. So some other areas of context that really can impact an intervention's fit with an organization include our state or our agency values and priorities, any practice models or other ongoing initiatives that we have going on. Does it fit with those? Our agency structure, whether we are a state or a county administered system, various contracting arrangements and what their requirements are, our staff skills, qualifications, and credentials, worker norms and beliefs, our community demographics and the languages that are spoken, our target population, what are their values, customs, and preferences. And then the geographic setting can also impact. for example, whether it is an urban or a rural population, and then a number of other contextual factors that may be local to your jurisdiction that you want to consider. So assessing feasibility and capacity. When we're talking about all of the different options that we have to look at, we should really be assessing whether each one is actually doable. Can we pull this off? And teams may consider feasibility in a number of different capacity areas. So our resources, do we have the funding available? Do we have staff with appropriate qualifications and the technology to support it? So our infrastructure is things like our policies or our internal systems. Knowledge and skills. Does our staff have the related competencies to actually implement the intervention? Culture and climate. So is our leadership committed to the change effort? And does this intervention align with our agency values and norms? And then engagement and partnerships. Do we have the internal and external organizational relationships to support an implementation of this intervention? So at this point, when teams are assessing these above factors in terms of general compatibility, you really want to think, just does it seem reasonable? While you may not have the full capacity for an identified program, you'll also want to consider whether you can actually build that capacity later on to support implementation. So I'm going to turn it back over to our panel, and I'm going to hand it over to Juliana to talk about this piece of it. And so Juliana, when assessing fit and feasibility, how can jurisdictions integrate information gathered into their assessments of potential interventions?
Thanks, Nicole. I think as you were saying, and really to kind of echo, it's so important for anyone supporting jurisdiction teams in the intervention selection process to really understand the contextual factors that may support or impede implementation of the intervention. And these, of course, some of these were raised early on in this conversation by folks who are on the call. So things like buy-in, scaling up, capacity to do this work. Is it evidence-based? The cost, leadership stability, turnover, patience, and so on. These are commonly found challenges, and I think the ability of teams to be able to lift these up and address them, sort of plan for them early on, will help lead to the right intervention selection and then effective implementation down the road. And so I think part of this, and we've talked about this a little bit too, is being able to consult with others who have implemented this intervention. What I've done in some of my jurisdictions is we've helped prepare for peer conversations by developing a list of kind of key questions, what they want to know from the other site. And I think it's also important too if you're able to get the opportunity, particularly if you're working with a really complex intervention, you might want to talk to folks who are at different phases of implementation. So in one example with the state that I worked with, we had a very complex intervention, and it was really helpful to talk with several sites, some who had implemented this years ago and we're now looking at sort of refreshing it, some who were sort of at the middle stage of implementation, and another team that was really starting off. And so it was really helpful, I think, for them to sort of see lessons learned from other folks and understand what to expect at different stages of implementation. So with that, I'm going to turn it over to Joan to share with us some recommendations on how jurisdictions can effectively assess their agency context and capacity for an intervention they know has been successful elsewhere.
Okay, thanks, Juliana. And yeah, and this obviously is just going to be building a little bit on some of what Will and Nicole and Juliana have already kind of put out there. But one thing I just think about with my experience in working with states, and I really want to highlight here, is the need to be really very deliberate in your efforts in terms of fully assessing your own agency's contextual issues. And by this I mean just like, really thinking about your agency values, your priorities, your practice model, what's going on in terms of large, ongoing initiatives, your agency structure, your operating system, your unique staff workforce issues, as well as, kind of the target population considerations. And I mention this because this really impacts your ability to be able to effectively adapt somebody else's intervention for use in your own agency. So just being a little bit more deliberative here, being able to step back and see everything, I think sometimes it's hard to do that because we're always in such a rush because we have to get things done. But forcing yourself and using a structured process like this, I think my experience would tell me that this would be very useful. I think also just taking the time and to step back and thoughtfully reflect as a team on any previous work that you guys have done in terms of, especially in areas like problem exploration and developing a theory of change for your identified problem area. Before you decide on whether to adapt an intervention that's already kind of out there to address something that's unique to your agency's area that you've identified, you'll want to make sure that it's a good fit for your target population and that it really is going to address the root causes that you all took the time to identify that you guys worked on, and that it aligns with the conditions, the actions, like those causal links that you identified as necessary for the changes to unfold as part of your theory of change. So just taking the time to really kind of force yourself to step back and look at that and have those discussions. I guess otherwise, in terms of my work with states, I would just say if you've already conducted any type of a formal or even an informal readiness assessment, it's useful to include the findings of that in your discussions that you're having when it comes to intervention selection or adaptation. And this can include information that you've already integrated into, past or more recent planning documents, such as, your agency's CFSP, your more recent APSR, anything having to do with your CFSR with your statewide assessment or your PIP. A lot of work goes into those documents. And whether there's any lessons that you've learned or others have learned on your team, good lessons or bad lessons from those prior experiences that could help inform your thinking and your decision-making as it relates to selecting or adapting an intervention. Another recommendation I guess I would make is that I really think it's worth the time to consider whether you have the right team in place to participate at this particular point in the change and implementation process. And I say that because I'm sure a number of you, whether you've been part of some of these other calls before or, whether you've just done this work before, but this is, you bring a team together and you work to identify a problem and you figure out what the root cause is and you develop a theory of change. But as you go along, it's always just good to take the time to reflect on where you are in the teaming process because it should be dynamic and the needs and what you're focusing on in your team are going to change over time. And so again, being very deliberative and you're thinking on this and stepping back to look at whether or not you've got the right people at the table for this particular stage of the change process. So for instance, the addition of program experts or specific stakeholder groups, they can play a very important role in processing through a lot of these contextual considerations that we've been talking about today. And you may also even need to schedule some additional time outside of these discussions with the team to bring other people to the table. So for instance, I don't know if it was Juliana or Nicole, but we were talking about just, who are the people that are really going to be delivering the intervention, really that you're going to be leaning on, or who are going to be on the receiving end and making sure they're part of those conversations. I would also, I guess, recommend that you ask yourselves whether or not the goals of the intervention you're considering right now aligns well, again, with your agency values, where you're at right now priority-wise within your agency and within your organizing or operating structure. So, taking into consideration whether you're state or county administered, if you rely heavily on providers to carry out a lot of your case practice work, are you a privatized system? Are you engaged in performance-based contracting? Do you have a unionized workforce? For some states, this is an issue where the intervention you're considering might create major changes in the way you deliver your services, policy changes, things like that, that actually could impact your contract negotiations. So not that you shy away from that, but this is all about just being kind of ready and taking all of these things into consideration. Some of the other things, a few others, would just be kind of considering the norms of your workforce. And this is really important when you consider who's going to be doing the lion's share of the work in implementing the intervention you have in mind, because you're going to be relying on them to make sure it's successful. So in many cases, this is going to be your caseworkers and your supervisors. But if it's something that's going to lean heavily on training, that's a different workforce. If it's going to require a really high, heavy lift from your your IT division, then you're going to really want to make sure that you have a good feel for what the norms and values of that particular workforce are as it relates to the intervention you're considering. And then, also just having, again, a very honest discussion with the team that's engaged in this about how the intervention is going to address the kind of the identified target population's needs. And if it's something that you're looking at that's worked well, if you've kind of researched something that looks like it's worked well in another place and you're really interested in it, but the target population was older youth, are you confident that you can, adapt that in a way that doesn't kind of mess with the integrity of that intervention if you're going to need to adapt it for a much younger population? Is it something that you can take from the confines of a smaller agency and then adapt it to a much larger and more complex agency if that's what your agency is like? So, whatever it is that you need to do to adapt that intervention, what supports or changes are going to be needed, you're going to need to have discussions around that contextually. And then finally, I would just focus on, the capacity areas within your agency, and again, having very honest conversations within your team and with leadership and whomever you need to have about whether your agency either has the current capacity or could potentially build or create the needed capacity in the future so that you're able to effectively implement and sustain the intervention that you're interested in, in implementing over time. Thinking about things in a very real way. How much is it going to cost? Do we have the right staff? Do we have the internal expertise to pull it off? If we need to bring in outside experts to do it right, are we going to be able to afford it? Are there going to be any barriers contractually or, legislatively, to hiring out? So just, really, again, forcing yourself to kind of have those conversations. Those are the recommendations that come to mind for me. So, that's kind of it for me, Nicole.
Great. Thanks, Joan. Those were great recommendations. I hope everybody was taking notes, right? No, thank you for sharing your expert opinion and your expertise in doing this work with jurisdictions, for all of you. So we'll move on to, we have a few more sections before we get into our breakouts today. Moving into the next section, we talked a little bit about what defines a well-defined intervention earlier, those core components. And so when we actually get to the point where we have some possible interventions to look at, we really want to pay close attention to whether each of those options is really clearly and sufficiently defined. So we want to make sure that we review all of the available materials that are included with it, consider if there is enough material there and enough guidance for us to actually implement that. We have to be able to explain it. We have to be able to teach it to staff, to implement it and to monitor it to see if it is working as intended. So teams should really think about whether the intervention is clear. Is it clear what it is? Can the intervention be easily explained to others? Is it usable? Does it have a clear description or the core components that we talked about? Does it have those operational definitions or the actions? Does it already include the information that you would need to do a performance assessment or to do your fidelity process? If it needs to be adapted from another source, is it easily transferable? Is there enough information to be able to replicate it? Or if it's untested, can it be evaluated? Can you set up a structure that will help support evaluation?
There are two additional components to determining a well-defined intervention and whether there is enough information and guidance to transfer and replicate it. The two last components are practice profiles and program manuals.
So the big one, deciding whether to replicate, adapt, or design. So this illustration that you see on the slide here is kind of just what we call the continuum of fit, from really one extreme of finding an intervention that is an absolute perfect fit, which we all know probably really doesn't exist very often in child welfare, to the other extreme of finding nothing that is even close. Ideally, teams will find an evidence-based or a well-defined intervention that addresses their problem and is a good fit for their agency in column one, but unfortunately, like we said, that can be very hard to find. So oftentimes they'll need to adapt an existing intervention for their particular agency setting and context and target population, as we see in column 2 and 3, so kind of like that pretty good or that partial fit. So this might involve adapting some components or a mixture of adapting components and designing new ones. Or agencies may need to further define and operationalize an appropriate but maybe unproven intervention. If they really can't identify an appropriate intervention to implement as is or even adapt in any way, shape, or form, they may actually need to design an entirely new one. So let's look at some considerations that will help a team make this choice to replicate, adapt, or design. So does the intervention address the agency's identified problem and theory of change? We've talked a little bit already about that alignment. Does it match? Is there evidence that the intervention will work? So when it's possible, teams should really prioritize those ESIs, or the evidence-supported interventions, the ones that have strong evidence and positive outcomes, including research where it's possible, practice evidence, and really having a strong theoretical backing. Is the intervention well defined? Is it usable or transferable? Does it have the components and definitions to be able to implement and assess the implementation? If it's not well defined, but it can be, teams will need to maybe do some work to further define and operationalize that intervention before they get to implementation. Does the intervention fit the agency and population? So we've talked a little bit about that fit, consider whether adaptation is really needed to increase the relevance of the intervention to the population you're trying to work with, or whether you need to accommodate specific organizational differences. And then whether adaptation is really feasible without changing the core components or compromising its effectiveness, as Joan was talking about. So is the intervention feasible for the agency to implement? Again, do we have the capacity? Does it seem reasonable that we can build the capacity to implement it? So then you may want to consider that intervention. If it doesn't seem realistic that you'll be able to build enough capacity to implement that intervention, then you really have to continue to look for something different. And then is a new intervention necessary? Consider whether the agency really has the time or the resources, as we've talked about, to devote to developing and designing a completely new intervention. So those are just some considerations. So possible reasons that would make you want to choose to adapt, and then some reasons that should not be used to adapt. So what are the things that might indicate that we could take an intervention and adapt it over time? So to implement it with a different target population, perhaps, including different populations that may differ by race or ethnicity or culture, maybe language or age, gender or gender identity, whether or not it's in an urban or a rural setting, the risk and protective factors of that particular population. It might also be to accommodate differences in the organizational structure or in the way that we deliver the services. For example, is your system a public or a privatized child welfare system? What role does the caseworker have in this intervention? Is it case management or is it more direct service delivery? To integrate an intervention into existing programs, practices, or services is another possible reason to adapt. And then maybe we have to revise some materials or activities because that particular evidence lacks relevance for our target population or setting. Maybe we need to translate it into a different language because we have a population that has a language barrier, or maybe they're just simply outdated. So what about some reasons that we should not be using to adapt an intervention? So we never want to cut corners. So we don't want to make it easier, faster, or more convenient to implement because that's really going to impact the evidence and the outcomes. We want to stick to, we don't want to adapt to be able to stick to our current practices and infrastructure. So we want to be able to be a learning organization. And then we shouldn't be adapting just to accommodate our workforce who may or may not be familiar with these new practices. So if we have to integrate some component of coaching and training into our implementation planning, then that should be a consideration before you move forward. All right, so considerations to designing an entirely new intervention. So as we talked about, there may be some cases where there are not an appropriate ESI or even a well-defined intervention and can't find one that really fits and is feasible for the agency to implement. It may be that you actually need to design a new one. It is definitely an opportunity to customize an intervention to agency needs and to add to the evidence base, but it's definitely something that can demand a substantial amount of time as well as resources. And those time and resources are required not only for designing and developing the intervention itself, but also for testing it, for making adjustments based on what you learn through testing, and then designing and implementing appropriate evaluations of the implementation and the outcome. Designing new interventions really doesn't mean we have to start from scratch though, right? As we were talking about kind of some of those common elements, full interventions may not necessarily be an option, but teams can select and combine some of those existing intervention components into a comprehensive intervention strategy. Those components really, again, should go back and align with the team's theory of change, and the evidence and the research that we have should support their use alone or in conjunction with some other pieces. So consult and reach consensus. Juliana talked a lot about, and Joan too, about that stakeholder engagement and the teaming. It's really, really important that teams consult with the key stakeholders about the interventions that they're considering. So the groups who will receive services, for example, youth for new programs addressing youth transitioning to adulthood, or relative caregivers for kinship support programs. Any of the groups who will provide, coordinate, or oversee those services. So our caseworkers, our program managers, any private contractors that we have that might be providing services, or other community service providers. And then any groups who may be interacting with or be impacted by the intervention. So some of our system partners like lawyers and judges, foster parents, and even our community service providers. So we want to make sure that we consider all of the available information and input, and consider all of the team members and decision makers to decide which intervention will likely have the best impact and be a good fit with the agency and our target population. And oftentimes that decision is going to reflect one of the three paths that you see there on the slide. So oftentimes we're going to be replicating with a minor adaptation, or we're going to adapt an intervention with major changes, or in that sometimes case we do have to design and develop a completely new one. So I'm going to turn it over to our panel for a few more moments of conversation around selecting interventions in practice. And so I'm turning it over to Will first. So Will, I'm hoping that maybe you can share with our participants some guidance regarding how you might make the decision to replicate, adapt, or design an intervention.
Yeah, thanks, Nicole. I think that this, I love, as John was talking during the last questions about her keying in and thinking about within your agency, within your situation, trying to think about really doing the analysis and the assessment around the context of where you find yourself, where your agency finds yourself. I think that with this intervention selection and design adaptation brief that is now available, the slide 25 of this PowerPoint, and it's exhibit 4 of the brief, is that continuum of fit that Nicole was talking about. And it's, it kind of lays out in terms of thinking about the decision to replicate, adapt, or design. And, we really think it makes a lot of sense to work with your team, to work with the people who are looking at intervention selection, to kind of think through this continuum based on the research, based on the analysis, based on the feedback that you've gotten from stakeholders, and really looking at, where does it fall along this continuum of being a perfect fit to not even being close, and then what direction is that going to drive you in terms of moving forward. And another thing in the brief, on page 23 of the brief, there's an example around designing a new intervention, and it's an example from the RISE project in Los Angeles, and they were faced with a void of well-defined ESIs that address their target population, So as they were doing their comprehensive literature review, it became clear to them that there was a lack of interventions to be considered, that it would be possible to possibly replicate or adapt. So the LA LGBT Center worked together with the county agency and community organizations to move forward with designing a new solution. And they did that that design process in a very focused way that was based on implementation science approaches. And the project team started with a theory of change and identified 2 key barriers to permanency for their population. And they theorized that if LGBTQ youth in foster care and their families were competently identified and appropriately served, they would achieve safe and stable permanency. So the project team used research and evidence to inform their design concept. They conducted a research review to identify risk and protective factors and promising practices closely linked to the target population. Their research included interviews with youth formerly in foster care, focus groups with foster care staff. They convened an expert roundtable. They did case record reviews to identify barriers to permanency. And the team used all of that research and that information to develop a design that was going to address the needs of their population at multiple levels, and that was going to the level to specify the core components so that it would be clear of what the intervention is, and set them up in a way to where they can move forward with implementation with fidelity. The reason that we're highlighting this example, and it's picking up on Nicole's description, is that when we're on that end of the continuum of not even close and looking at designing a new intervention, then the full team, the leadership, everyone involved needs to understand the time, the effort, the expertise that it takes to design and build a new intervention versus replicating or adapting. There are times that it's necessary, that's the direction that we have to move, but it's a decision that needs to be well informed by the data, well informed by the research, well informed by everybody understanding what the organization is taking on, then to move forward with designing a new intervention. So Nicole, I think that's getting at this part of the discussion.
Absolutely. Yeah, I couldn't agree more, Will. Thanks for sharing that example. Again, as a reminder, folks will have access to that brief in the breakout sessions, and that it is also currently available on our Change and Implementation webpage. So thanks for sharing. So let's move on. We have a few more slides before we're moving on to our breakout sessions. So let's talk a little bit about some of the common mistakes. And we've talked about a lot of these already, right? So not fully assessing fit with other interventions or initiatives currently being considered or currently in use. So it's important to look at how an intervention fits within the agency and considering how it may complement or how it may hinder other initiatives is just as relevant and should be incorporated into assessing each intervention considered. Moving too fast. We've talked about it a number of times. Intentionality is key, and I know that that's a difficult balance when we are pressed for time and have to move into a decision-making situation quickly. But taking that time to thoughtfully consider the interventions in the agency's fit and context, and then making that decision to replicate, adapt, or design will really be critical to their ability to implement it effectively. Joan said it a lot, and Juliana, not including all of our stakeholder groups. in reviewing and assessing the fit and feasibility of the interventions. Those who are going to be doing the work, those who are going to be receiving it, likely have the most valuable input on whether or not they think that that intervention will be successful. And then not fully committing the resources needed to replicate, adapt, or design an intervention. So, if you know you're not ready, but you choose to move forward anyway, or you don't have the capacity, but don't have a plan to build in the capacity to actually implement, it's going to be very challenging to actually see the outcomes that you're looking for in a particular intervention. So let's talk a little bit about defining the it. So regardless of whether we are replicating, adapting, or designing a new intervention, we have to be able to define the it. So this means that we have to be able to explain the intervention and all of its parts in really simple terms so that our stakeholders are clear on what it is and what needs to be done to actually carry out the intervention. And so there are a couple of key things that you need to consider before developing a proposal. So you want to state the intervention's purpose, goals, and underlying principles. So it's essentially a purpose or a mission statement that will very briefly describe what the intervention does, why it does it, and how the goals should outline, and the goals of it, and that should outline the expected results. The guiding principles really are the norms and the values and the philosophies that shape those components and activities and the decisions that will be made throughout the course of implementation. So a child welfare principle might include, for example, the importance of integrating youth and family voice in our program development and service delivery. And then the second part of defining the it is identifying those core components and really calling out how they align with the team's theory of change. So what are the essential mechanisms that make the intervention work? Describe each of the intervention's core components that address the identified problem. And so often these are really kind of expressed into broad terms like engagement, assessment, or collaboration. And then after a proposal, we want to, after sufficiently defining it and including the core components, we pull together the research and our assessments and the recommendations into that formal proposal document that clearly really explains the intervention, the reason that we have selected it, and outlines our plans for moving forward into implementation. So these really are a written document that support and communicate the decision-making process about how you came to this particular intervention. So they're essentially the what, why, and how of this particular intervention. And then you want to plan for replication or minor adaptations. So when you develop a proposal for replication or minor adaptation, you want to present your rationale for selecting that intervention and outline how you plan to replicate it with fidelity. There is often an outline included of all of the proposal contents, and in Exhibit 8 of the actual brief, you can see one that we have prepared that shows all of the different components that should be included in that proposal. So after developing the proposal, teams should further operationalize and define those core components. Specify the features and the activities that really make the intervention work. And part of the reason that we say to do this after the proposal is developed and approved is because these activities often take a lot of time. And so you want to make sure that you have a kind of a green light before you invest the time and the effort into developing those the practice profiles and the essential behaviors before you move forward. There's also a lot more information in the brief about how to create a practice profile, as well as more information about adaptation. So feel free to get that resource whenever you have the chance. Before we move into the breakout sessions, I do want to take just a couple of minutes to do a quick poll. There's 3 questions, and don't feel obligated to answer all 3 of them. We'll leave this up for a couple of minutes, but if you only have time for one of them, feel free to answer. And what we want to ask you is, what are some of the mistakes that you have seen when selecting an intervention? What impact do those mistakes have on the implementation and the success of the intervention, or what impacts have you seen so far? And then what strategies would you recommend to prevent some of those common missteps? So we want to be able to take some of these responses into the breakout sessions so we can have some really good continuing conversations about intervention selection. So rushing to a solution without doing any of what you've been talking about, yes, yes, yes. And not evaluating, yep. And not including youth and providers on the planning committees, absolutely. that stakeholder engagement and sustained stakeholder engagement is so important. And so the solution generally didn't work very well. Okay, yeah. I'm sure you have some reasons that you think that that might have happened. It was unsustainable and ineffective. Yeah. Follow the steps that have been well researched and established. So yes, what strategies to prevent considering this capacity in the future? Yeah, absolutely. These are great responses, and we're going to have some time with our facilitators to lead some breakout conversations with us in smaller groups. And I'm going to turn it over to Chris. So Chris, I'll turn it over.
Thanks, Nicole. We are at the end of our scheduled time, so we will be finishing this webinar shortly. Feel free to contact us using our website, capacity.childwelfare.gov/states. That's capacity.childwelfare.gov/states. You can also contact us by our email address, capacityinfo@icf.com. That's capacityin@icf.com. Or by our phone number, 844-222-0272. Thank you for joining us, and have a great day.